This week marks National Nurses Week, honoring the contributions and sacrifices of nurses in the healthcare industry. Joining us this morning is David Grayson, a registered nurse in the neonatal intensive care unit at Northwestern Memorial Hospital, and also a Friends of Prentice board member. Thanks so much for being here this morning.
Well, thank you for having me. Appreciate it.
Now, you've been a neonatal nurse since 2001. What led you down that path specifically?
In nursing school, kind of always interested in healthcare and generally, but in nursing school I did a lot of rotations through the NICU and I was involved with some research in the NICU as well. And just seeing the patient population, it's a fun and exciting place to be, and so rewarding.
Now, for a lot of parents, if they find out that their little one is in the NICU, it can be kind of a stressful situation, especially if it's unexpected. Can you tell us about some of the relationships you formed with those parents, maybe years down the line?
Oh, absolutely. Over my many years of being in the NICU, taking care of thousands of patients, and have made close bonds with many of their families, and have been able to carry those on, throughout the years. Still get together with them periodically, and it's incredible to see them grow from tiny little infants, oftentimes extremely premature, to some of them being grown adults now.
Wow, super cool for real, and I'm sure those parents appreciate those conversations and you kind of ease them through what could be a tough time for them.
Yes.
We also know that you're also giving back to the community as well. Can you tell us a little bit about your work with the Friends of Prentice and your role as a board member there?
Yes. So being a nurse in the NICU, kind of see all the aspects of women's health and the importance that research provides into leading to new discoveries in women's health. So I joined the board the Friends of Prentice, where we raise money for women's health research. We give grants to nurses, physicians, and researchers, and it's a great organization. There's just not enough funding in women's health, so all we can do to raise funds and kind of give back to the Prentice community and to women's health in general is very important.
And while we have you quickly, we've heard a lot about shortages in the healthcare industry. What are you seeing on a daily basis, and how is that impacting what you guys do every day?
In the NICU, I'm kind of isolated from a lot of the shortages. We are well staffed, but there are always needs for nurses kind of throughout medicine. As we have an aging population, there is definitely a need for more nurses and for those to provide health care. And as a male nurse in particular, I think it's a great area for men to get involved with as well as women because of all the opportunities that we have.
And hopefully somebody will see this story and maybe decide to take that up. David, thanks so much for your time this morning.
Thank you. Appreciate it.